Did you know that your sleeping position could be directly linked to memory loss after 60? Moreover, sleep is critical for testosterone production, not just an observation, but a fundamental aspect of male physiology. Lack of sleep is one of the most powerful and rapid factors that inhibit testosterone levels, impacting both your health and emotional well-being. It may sound surprising, but science has proven this. Furthermore, your sleeping position affects how the brain cleans and protects itself at night. If this cleaning process doesn't occur properly, toxins build up, memory begins to decline, and the risk of developing memory-related conditions increases. Perhaps you've noticed yourself forgetting names, dates, or where you put your glasses. This may seem normal with age, but what if a specific trigger is partly to blame? By the way, how do you sleep each night? In this video, I'll explain it all. Which sleeping positions might be erasing your memory? And more importantly, which position is correct to protect your brain, maintain independence, and improve the quality of your life? I'll share real patient stories, explain scientific discoveries in simple terms, and guide you through practical, easy-to-understand tips. So get ready to make small changes that could help protect your sexual health, memory, mental well-being, and even your independence. Let's get started. 1. The brain's cleaning cycle, the glymphatic system. Have you ever stopped to think that something as simple as your sleeping position could directly affect your brain? Many of my patients say, "Doctor, I sleep well, but my memory is deteriorating. Is this just because of age?" Of course, aging brings natural changes, but in many cases, the issue is not just age, it's how the brain is cared for during sleep. At night, your brain performs a vital function. It actually cleans itself. Just like a house at the end of the day, the brain starts clearing out toxins that have accumulated while we were awake. This cleaning process is crucial to preserving memory, maintaining mental sharpness, and reducing the risk of diseases like Alzheimer's. But here's the issue. This cleaning process isn't effective in every position. If your head isn't properly aligned or the flow of cerebrospinal fluid is disrupted, the system responsible for cleaning won't function properly. Over time, these toxins accumulate. As a result, memory starts to decline, forgetfulness increases, and the risk of developing memory-related conditions silently rises. I recently treated a patient named David, a 70-year-old man who always slept on his stomach. He complained of cognitive difficulties when he woke up, like forgetting where he put his keys or retelling old stories. When we simply changed his sleeping position, his symptoms improved within a few weeks without medication, just the right information and guidance. Have you heard anything similar? That's why understanding what happens in our brains while we sleep is the first step in protecting it. During the day, the brain is busy processing thoughts, making decisions, regulating emotions, and storing memories. But at night, when you sleep, it switches to another mode, deep cleaning mode. This function is so important that nature has created a system to carry it out. The glymphatic system works like a drainage network that helps remove waste from the brain, such as harmful proteins and metabolic byproducts that accumulate naturally throughout the day. Now, imagine what happens when you don't sleep well or sleep in the wrong position. This system gets clogged, the brain's cleaning process doesn't happen as it should, and these toxins remain circulating, affecting areas responsible for memory, focus, and decision-making. One of the most dangerous proteins that accumulates when the glymphatic system isn't functioning is beta amyloid, which is directly linked to Alzheimer's disease. What's most alarming is that MRI studies have shown that individuals who have disrupted sleep or sleep in poor positions tend to have higher levels of beta amyloid in the morning compared to when they went to sleep. I like to compare this to a river. When the water flows freely, everything is fine. But if something blocks the river, it overflows, and what should have been cleaned up becomes problematic. In my practice, I see this often. Kathy, a 74-year-old woman, used to sleep sitting up in a chair due to lower back pain. Over time, she began experiencing troubling memory loss symptoms. When we helped her learn to sleep on her side with proper spinal support, she was able to remember her grandchildren's names again. Sleep is not just about resting, it's a natural treatment for the brain, but only if the position allows the glymphatic system to work. It's fascinating to think that while you sleep, your brain is carrying out a real cleaning process. This cleaning process is not just a metaphor, it's physiology, proven by neuroscience. During deep sleep, brain activity slows down and blood vessels slightly contract. This allows cerebrospinal fluid, a clear liquid that circulates through the brain and spinal cord, to penetrate deeper into brain tissues. This fluid acts as a natural cleanser, washing the gaps between neurons and carrying away debris, toxic proteins, and waste products that, if accumulated, could harm brain function. This process happens quietly but is critically important, and it depends on two factors: sleep quality and body position. For instance, if you sleep on your back, this fluid might have more difficulty circulating, especially if you snore or have sleep apnea. Sleeping on your stomach can put pressure on important structures in the body. Sleeping on your side, especially on the left side, supports brain drainage and improves the brain's natural cleansing process. A study published in the journal Science showed through imaging tests that fluid circulation in the brain increases significantly during certain stages of sleep, especially when a person lies on their side. It is as if the brain is using this time to clear away the buildup from the day. I remember Mary, a lively 69-year-old woman who often complained about waking up with a heavy feeling in her head. After adjusting not only her sleep schedule but also her sleeping posture, she told her doctor, "I feel so much lighter in the morning." That is what happens when your brain is cleansed properly. You wake up sharper, clearer, and more fully yourself. Many patients I meet have never heard of the glymphatic system, and perhaps you have not either, but it is one of the most important discoveries about the brain in modern medicine, especially for people over 60. The glymphatic system works like the brain's drainage system, removing harmful waste products that build up in brain cells. Its name comes from the combination of glia, the brain's support cells, and lymphatic, the body's cleansing system. In other words, it is the brain's cleaning network, working hand in hand with glial cells. But here is the challenge. As we age, this system becomes slower and less effective. The flow of cerebrospinal fluid that helps clean the brain decreases. This raises the risk of buildup of harmful substances such as beta amyloid and tau proteins. These proteins are directly linked to the development of neurodegenerative diseases like Alzheimer's and Parkinson's. Research also shows that sleep has a direct effect on men's physical strength and vitality. One of the strongest connections is with testosterone levels, the close connection between sleep and testosterone. To say that sleep is important for testosterone production is not just an observation, it is a fundamental truth of male endocrinology. Sleep loss is one of the fastest and most powerful suppressors of testosterone levels. A study titled "Effect of 1 Week of Sleep Restriction on Testosterone Levels in Young Healthy Men" by Lepro and Van Cauter, published in the Journal of the American Medical Association, JAMA, in 2011, made this clear. The researchers studied 10 lean, healthy young men with an average age of 24 in a controlled sleep laboratory. They went through 2 phases, a baseline phase of 3 nights with 10 hours of sleep and a sleep restriction phase of 8 nights with less than 5 hours of sleep. The main finding was that after only 1 week of restricted sleep, daytime testosterone levels dropped by 10 to 15%. The researchers noted that this decline was equal to what naturally occurs after 10 to 15 years of aging. In addition, the men reported feeling less healthy and less energetic as their testosterone levels dropped. This study strongly shows that the effect of poor sleep on testosterone is not minor or theoretical. It is significant, fast, and affects both physical signs and personal well-being. Testosterone production does not occur at a constant rate. It follows a daily rhythm, peaking in the early morning around 8 a.m. and reaching its lowest point in the evening. This rhythm is not random, but closely tied to the sleep-wake cycle. The process is controlled by the hypothalamic pituitary gonadal (HPG) axis. Although people often say that most testosterone is produced during REM sleep, the reality is more complex and involves the entire sleep structure. The first major rise of luteinizing hormone, LH, begins soon after falling asleep, closely linked to the first stages of slow-wave sleep, stage 3 NRM, the deepest and most physically restorative sleep. This is when the body focuses on repair and rebuilding. Later, REM cycles, especially the longer ones that occur in the early morning hours, play a key role in sustaining and maximizing testosterone production. In short, slow-wave sleep starts the process, while a full night of sleep, including REM, is necessary to reach the morning peak. As men age, their natural sleep structure changes. They experience less deep slow-wave sleep and more frequent nighttime awakenings. This means their opportunity window for testosterone production shrinks. On top of that, the HPG axis itself weakens with age, sometimes called male menopause. Leydig cells respond less to LH, and the pituitary gland releases less LH with each pulse. With fewer reserves, the older male system cannot recover from stressors like sleep loss as effectively as the younger body can, leading to greater and longer testosterone decline. And here is a crucial point. Your sleeping position can either help or hinder this system. After age 60, when the body no longer regenerates as it once did, every detail matters. If the glymphatic flow is already reduced by age and a person continues to sleep on their back or stomach, brain drainage may be seriously impaired. 2.1. Sleeping on the back. Although this position is often recommended for keeping the spine aligned, sleeping on the back carries serious risks for brain health, mainly because of its impact on breathing. When lying on the back, gravity pulls the tongue and soft palate backward, narrowing or sometimes even blocking the airway. This leads to snoring and, in more severe cases, obstructive sleep apnea, OSA. The American Academy of Sleep Medicine, AASM, highlights that OSA causes repeated drops in blood oxygen levels, forcing the brain to briefly wake up many times during the night just to restore breathing. These frequent micro-awakenings prevent the brain from entering and staying in the slow-wave deep sleep that the glymphatic system requires to function properly. A study published in the journal Sleep found that patients with severe OSA showed significant disruption of the blood-brain barrier and reduced glymphatic function. In simple terms, without deep and stable sleep, the brain's cleaning crew cannot perform its work, leaving toxins to accumulate night after night. One of my patients, Robert, age 75, illustrated this perfectly. He came to me complaining of forgetfulness and mental fatigue. His cognitive tests were normal, but he had developed the habit of sleeping upright because of acid reflux. With medical guidance and small adjustments to his posture and bed height, we improved his nighttime sleep position. Within 2 months, Robert felt more alert, and his memory became more stable. The glymphatic system works silently, but its effectiveness depends on the choices you make each night before you fall asleep. Do you know which sleeping posture is most harmful to the brain? Many people believe lying on the back is the most neutral position, but this is not entirely true. Let me tell you about Linda, a graceful 72-year-old woman who came to my office with her daughter. She had become more forgetful, often repeating questions and sometimes confusing names of loved ones. While not severe, her family grew concerned. During our conversation, I learned she had been sleeping exclusively on her back, with 2 pillows stacked for over 30 years. She found it comfortable and never questioned the habit, but there was a catch. She snored heavily, woke up many times at night, and felt drained each morning. We explained to Linda that sleeping on the back can increase pressure on the airway, encouraging both snoring and sleep apnea. These breathing interruptions reduce oxygen supply to the brain, directly affecting memory and clarity. In addition, this position can decrease glymphatic flow, weakening the brain's ability to clear waste during sleep. I suggested she try sleeping on her side, placing a pillow between her knees and an additional pillow for neck support. The first few nights were uncomfortable. Changing a habit built over decades is never easy. But after several weeks, Linda reported fewer memory lapses. She woke with more energy and felt more present in conversations with her grandchildren. Sleeping on the back may look harmless, but it is one of the most limiting positions for brain oxygenation and nervous system cleansing. It is important to notice how you feel upon waking. If you find yourself confused, mentally tired, or as though you never rested, the problem may lie in the way you sleep. Many of my patients tell me that lying on the back feels most comfortable, and in some cases, it may ease hip or shoulder pain. But when it comes to brain health, comfort does not always equal safety. Sleeping on the back, also known as the supine position, can bring risks that many overlook. In this posture, the base of the tongue and tissues of the throat tend to fall backward, especially when muscles relax during deep sleep. This can partially block the airway, causing loud snoring or pauses in breathing that disrupt rest and lower oxygen delivery to the brain. There is more. Brain imaging studies have shown that when lying on the back, the flow of cerebrospinal fluid, which helps cleanse the brain, may become less effective, reducing the removal of toxins such as beta amyloid. Thomas, a 76-year-old man, believed this posture was the most natural. Yet he often felt mentally drained, forgetful, and irritable upon waking. Through a simple sleep test, we discovered frequent brief awakenings caused by light but persistent snoring. By shifting to side sleeping with supportive pillows, Thomas not only slept more peacefully, but also noticed better concentration and memory. Every case is different, but if you lie on your back and wake up tired, or if your partner notices you snore heavily, it may be time to consider whether comfort is hiding a greater risk. Paying attention to your body, making adjustments, and seeking guidance can protect your most valuable asset, your mind. After many warnings about the risks of sleeping on the back or stomach, one final question remains: which sleeping position best protects the brain? Science has given us a clear answer: the side position. 2.2 Left side sleeping versus right side sleeping. One of the most common questions I get from my patients is, "Doctor, which side should I sleep on?" The advice to sleep on the left side is based on several anatomical advantages. First, the stomach naturally hangs lower than the esophagus, reducing the chance of acid reflux, GERD, a common cause of sleepless nights. Additionally, the aorta, the body's largest artery, curves to the left. Sleeping on the left side allows gravity to assist the heart in pumping blood more easily. Furthermore, the main lymphatic duct, the thoracic duct, drains into the circulation on the left side, and this position may help the lymphatic system circulate more effectively throughout the body. This combination of better blood circulation and reduced sleep disruptions caused by GERD creates a more stable environment for deep sleep, optimizing brain cleansing processes. So, left or right? Let's break it down step by step. Some studies using brain imaging and analyzing lymphatic flow have shown that sleeping on the side, particularly the left side, boosts the brain's cleaning system. In this position, cerebrospinal fluid circulates more efficiently, helping to remove toxins like beta amyloid more effectively. Additionally, sleeping on the left side benefits digestion and circulation, especially for people with acid reflux or heart issues. The stomach and pancreas are positioned better, aiding digestion and reducing discomfort during the night. However, for some, sleeping on the left side may cause discomfort in the hips or shoulders. In such cases, sleeping on the right side can also be a safe option, as long as the body is well supported with a pillow between the knees, under the head, and, if needed, behind the back. Maria, 70 years old, is a perfect example. She suffered from swollen legs and confusion when waking up. Simple adjustments like sleeping on her left side, elevating her legs slightly, and maintaining a good sleep routine led to significant improvements in both her sleep quality and mental clarity. There is no one perfect sleeping position for everyone, but there is a scientifically proven direction. Sleeping on your side, with your body properly aligned and supported, can be one of the best gifts you can give to your brain. Have you ever heard that sleeping on your left side is good for your heart? Well, you should know that this is true. This goes beyond what previous generations have told us. Today, science confirms this benefit, not only for the heart, but for the brain as well. Let's take a closer look at why. The heart is slightly tilted toward the left side of the chest. When you lie on this side, gravity assists venous return. In simple terms, blood from your legs and other parts of the body returns to the heart more easily. This improved blood flow contributes to overall oxygenation, including in the brain. Additionally, sleeping on the left side also promotes both the lymphatic and glymphatic systems, optimizing brain cleansing while you sleep. Studies have shown that this position helps facilitate the flow of cerebrospinal fluid, enabling more effective removal of toxins related to brain aging and memory loss. But the benefits don't stop there. This position also aids digestion. The stomach and large intestine are positioned such that the left side facilitates the movement of food and gas, reducing discomfort that could disrupt deep sleep. I remember Fernando, a 73-year-old heart patient, who struggled with bloating and mental fatigue upon waking. After changing his sleep position to the left side and placing a pillow between his knees, he noticed rapid improvements. He started sleeping better, waking up more energized, and even saw his blood pressure stabilize. These small details, while seeming insignificant, can make a huge difference in the quality of life for older adults. So if you haven't tried sleeping on your left side, it might be time to give it a go. Your heart and brain will thank you. Changing sleep positions might sound simple, but for many older adults, it's not that easy. Back, shoulder, hip, or joint pain can make adjusting at night difficult. But the good news is, with just a few small adjustments, you can sleep comfortably on your side without pain. The first thing I explain to my patients is that their body needs support, not just a mattress. Sleeping on your side requires proper alignment of the joints, which only happens when you use the right pillows. For example, a pillow between the knees will prevent the hips from rotating forward, protecting the lower back. Another pillow under the head should keep the neck aligned with the spine, neither too high nor too low. And if you feel like you might toss and turn during the night, placing a pillow behind your back will provide gentle support. Teresa, 75 years old, suffered from hip osteoarthritis and told me she couldn't sleep on her side. But with some adjustments to her pillows, she was able to sleep with less pain and wake up feeling more energized. Just by using regular pillows and following some simple guidelines, her sleeping position was no longer an issue and became part of her treatment. The mattress also plays a role. A mattress that is too firm will put pressure on the shoulders and hips, while one that is too soft won't support the spine. Ideally, a medium-density mattress will contour to your body and evenly distribute your weight. 2.3. Sleeping on your stomach. Sleeping on your stomach is a position many people adopt from childhood. It might feel comfortable and give a sense of security, but when it comes to brain circulation and cognitive health, it can be one of the worst choices you can make. This position is considered the most harmful for musculoskeletal and nervous system health. In order to breathe, you have to turn your head to one side for long hours, putting stress and twisting on the cervical spine. This can compress the vertebral artery, which runs through the cervical vertebrae and plays a crucial role in supplying blood to the back of the brain. It can also put pressure on the jugular vein, hindering the process of draining deoxygenated blood and waste-filled fluid from the brain. The combination of reduced arterial flow in and obstructed venous flow out creates a traffic jam for the lymphatic system. Not only is the supply of fresh cerebrospinal fluid likely to be restricted, but the removal of waste is also blocked. Over time, this chronic impairment can contribute to inflammation, oxidative stress, and the accumulation of neurotoxic proteins. Scientific evidence shows that sleeping on your side, specifically the left side, is the most effective position for promoting the glymphatic system's waste removal process. A groundbreaking animal study by Stony Brook University, published in the Journal of Neuroscience, used dynamic contrast MRI to track cerebrospinal fluid flow and found that the fluid movement is most efficient when lying on your side compared to lying on your back or stomach. When you sleep on your stomach, your neck has to turn sharply to one side to allow for breathing. This means your cervical spine is twisted for hours, compressing the blood vessels that supply oxygen to the brain. This prolonged twisting can subtly but continuously reduce blood flow to the brain. Over time, this can cause small damages that affect balance, memory, and even emotional stability. I remember the case of Isabel, a 67-year-old woman who had been sleeping with her face turned to the right every night since she was young. She came to me with symptoms of dizziness in the morning and trouble concentrating. After assessing her posture and blood vessels, we determined she had a narrowed vertebral artery, a condition worsened by chronic neck twisting during sleep. Thanks to physical therapy and some changes to her sleeping position, her symptoms improved dramatically. Another critical point is that when you sleep on your stomach, your chest and abdomen bear direct pressure, which impedes diaphragmatic breathing. This affects overall oxygenation and consequently brain health, not to mention the strain it puts on your lower back, shoulders, and jaw. Many older adults who sleep on their stomachs wake up with headaches, heavy foreheads, or stiff necks, unaware that the cause lies in their sleep position. So, if this is your preferred position, you may want to consider alternatives. Initially, changing this habit may seem difficult, but the long-term benefits for your brain and overall health are immense. Few people realize that snoring or sleep apnea is linked to memory loss, but the connection is profound and dangerous. Sleep apnea is more common than people think, especially after the age of 60, and it can significantly impact mental clarity, concentration, and even mood. Let me share the story of Antonio, a 68-year-old quiet retiree who began forgetting simple names, appointments, and even important family dates. His wife mentioned that he snored loudly and sometimes seemed to stop breathing for a few seconds during the night, but Antonio said he slept soundly and didn't think this could be related to his cognitive issues. We conducted a sleep study called polysomnography, and the results were clear: moderate sleep apnea. This meant his brain was deprived of oxygen for several seconds, multiple times per hour. Each time, his brain had to wake up quickly to regain control of his breathing, disrupting his sleep, preventing deep rest, and impairing essential cognitive functions like recent memory. The good news is that with simple adjustments, such as changing his sleep position, using the right pillows, losing a few pounds, and in some cases using a CPAP machine, Antonio regained much of his vitality. His memory gradually returned. He even said, "It's like I'm myself again." Sleep apnea can be tricky to diagnose. Many people don't even know they have it, but the consequences can be severe. If you snore loudly, wake up with a dry mouth, feel sleepy during the day, or often forget things, learning more about your sleep is just as important as caring for your heart health. 3. Practical strategies for an optimal sleep environment. If you experience tingling, pain when turning in bed, or stiffness in the morning, these are signs that your current sleep position might be harming both your body and mind. Don't ignore these signals. Adjusting your sleep habits could be one of the simplest and most effective ways to live with less pain and more mental clarity. Many people believe that a good night's sleep is simply about lying down and waiting for sleep to come. However, especially after the age of 60, your body needs preparation. Think of sleep like an orchestra tuning its instruments before the concert. This preparation is known as a bedtime routine, and it makes a huge difference in sleep quality and the protection of your brain. The first step is very simple. Establish a regular time to go to bed and wake up, even on weekends. The brain thrives on predictability. Going to bed and waking up at irregular hours disrupts your circadian rhythm and affects the production of melatonin, your body's natural sleep hormone. Another important tip is to turn off all screens at least 1 hour before bed. The blue light from phones and TVs suppresses melatonin and keeps your brain alert. Instead, choose warm lighting, read a light book, or listen to relaxing music. Consuelo, a 71-year-old woman, used to watch TV until she fell asleep on the couch. She often woke up in the middle of the night feeling disoriented. With simple changes like establishing a bedtime routine, darkening the room, and avoiding caffeine after 5 p.m., she started sleeping better and waking up with more mental clarity. Other helpful habits include taking a warm bath before bed helps relax the body and lower your core temperature, which in turn promotes deeper sleep. Avoid eating large meals in the evening. Opt for light, warm foods like soups, broths, or herbal teas. Also, note that regular physical activity during the day will improve your nighttime sleep, but try to avoid intense exercise close to bedtime. Your brain needs sleep to repair itself, process memories, and maintain emotional balance. A good night's sleep starts long before you lie down. It begins with the decisions you make throughout the day. As we age, it's natural for our sleep habits to change. However, many problems that arise in older age are not just a result of getting older, but also due to the accumulation of bad habits over time. 3.1 Common sleep mistakes and how to avoid them. Let's explore the most common mistakes I see in my patients and how you can avoid them. Mistake number 1, sleeping on an armchair or sofa. While it may seem comfortable at first, this position strains your spine, compresses your chest, and disrupts blood circulation. Elvira, a 74-year-old woman, used to sleep on her armchair in the living room because she felt it made breathing easier. However, she woke up feeling fatigued, with aches and mental confusion. After making small adjustments to her bed and the incline of her mattress, she returned to sleeping in her bed and noticed a significant improvement within just a few days. Mistake number 2, keeping the room too bright or noisy. Many older adults leave lights on out of fear of falling during the night, but even dim light can interfere with melatonin production. The solution? Install motion-sensing nightlights on the floor that only turn on when necessary, without disrupting the natural sleep cycle. Mistake number 3, overusing sleeping pills. Sedatives and anti-anxiety medications do not promote restorative sleep. They simply suppress brain activity without allowing the deep sleep stages necessary to reinforce memory. Instead of relying on medication, look for natural alternatives such as acupuncture, guided relaxation, or herbal remedies, always under the guidance of a healthcare professional. Mistake number 4, sleeping on your back or stomach without considering the impact on your brain. As mentioned earlier, these positions affect both breathing and the brain's natural cleaning process during sleep. If changing positions feels difficult, start slowly by using pillows for support until your body adapts. Remember, sleep is just as important as food and exercise. Avoiding these mistakes will give your brain the chance to age with clarity, energy, and independence. Have you ever imagined that something as simple as getting enough sleep each night could be one of the most effective ways to prevent neurodegenerative diseases like Alzheimer's? Science is proving what many doctors have observed in practice. Quality sleep deep and uninterrupted protects the brain from toxin buildup that leads to cell degeneration. For example, Alzheimer's disease is directly linked to the accumulation of a protein called beta amyloid. During deep sleep, especially when sleeping in the correct position, the glymphatic system works more efficiently to remove this protein. However, when sleep is disrupted or not used effectively, these toxins remain in the brain and accumulate over time. It's not an exaggeration to say that every poor night's sleep causes a small, silent damage to brain health. The most concerning part is that this damage happens gradually and only shows symptoms when it's already in an advanced stage. Encarnation, a 78-year-old patient, came to see me with early-stage memory concerns. Her tests were normal, but her medical history revealed that she had struggled with insomnia for decades, had used sedatives, and kept irregular sleep habits. With our joint effort adjusting her sleeping posture, treating mild sleep apnea, and rebuilding her sleep routine, she showed remarkable improvements. Today, she feels more confident, speaks more clearly, and has even returned to solving crossword puzzles, something she had stopped doing. The brain, even in old age, responds well to care, and getting a good night's sleep, properly positioned, in a suitable environment, and undisturbed is one of the easiest and most effective ways to protect your mind. Prevention begins with your pillow. Sleeping well isn't just about resting your body, it's about protecting your brain, maintaining memory, and ensuring mental clarity and independence for years to come. Throughout this video, you've learned that sleep position directly affects the brain's cleaning process, oxygen delivery, and even the prevention of diseases like Alzheimer's. We've talked about the risks of sleeping on your back or stomach, the benefits of sleeping on your side, especially the left side, and how to adjust your posture even if you experience pain or physical limitations. You've also heard real-life stories of people, just like you, who improve their health simply by changing their sleep position. Now it's your turn. Pay attention to your sleep posture. Make adjustments. Stick to a nightly sleep routine. Small changes can have a profound and lasting impact on your mind, memory, and daily health. If you found this content helpful, comment below about how you usually sleep and whether you plan to make any changes starting today. Like this video, share it with loved ones, and subscribe to the channel. Get practical and serious guidance on how to live healthily and with dignity as you age. Sleep well, take care of your mind, and I'll see you in the next video.